Hey guys, I'm Dr. Carrie. Welcome to this week's Vet Ranch Roundup. Bolt is extra snuggly today because I was out of town for a few days, and now I'm back, so he's stuck to me like glue. Hi, buddy. I know. But thank you guys so much for joining us. I have put all the videos on a playlist so you can binge them if this is your first time visiting our channel. And if you're not familiar with our main page of Vet Ranch, please take a peek at that. You will love to see some happy ending stories of our Vet Ranch animals from start to finish. But this week, I'm not really sure what we have going on. We need to chart the progress of Hera's neck and then just sort of tie up some loose ends, and we may get new rescues in. I mean, really, we just never know. Look at this guy. But let's jump in. The other thing I wanted to tell you is that I have a confession that I did a really weird rescue thing from a fish at a big box store. 3 fish actually, and only 1 lived. So I want to give you a little sneak peek at her because weirdly, I have grown incredibly attached to this fish. So I'll show you about that too. All right guys, let's get started. Well guys, when I was out of town this weekend, they let me know that Cleo was not feeling good, that she stopped eating, which is very abnormal for her, and also has lost weight pretty rapidly. She is sedated right now because they got a little bit of blood on her yesterday, but she can be a little bit fractious when she is being restrained. So we gave her some sedation this morning, and we're gonna draw blood and send it to a lab and see what's going on with her. It is really weird for her not to eat, and she has a really high fever. So thoughts are that she might have just contracted a respiratory disease from some of the kittens that we always have in and out of here, like calicivirus or herpes. But we worry more about that because she is FIV positive. So she has feline immunodeficiency virus, which means that she may not have the same immune system as any other cat. And so that's why we worry about her a little bit. So we're gonna draw some blood. Hopefully it's not bad news. She's sedated. I think we probably had like 3 or 4 people come by and freak out about how Cleo looks, but we're like, we sedated her. First thing I'm gonna do, since she broke her nails off in people's arm yesterday, some of them, is trim the rest really short. That way if she gets crump, I don't have to worry as much about her hanging from me. As you can see, we had to completely sedate Cleo because she was still, even with the kitty burrito
and some drugs
and a lot of drugs, where she looked like she was comatose, she came unglued at just the right time to make handling impossible. So she's really gonna love us when she wakes up with this. Cleo, I'll go get her bed. She's not happy with us. Hi, baby. So she has an IV catheter in now. We definitely did that when she was out, and then we're gonna start IV antibiotics, and then she's gonna be probably a little woozy tonight, just in the meantime while we wait to get the results from the lab. Cleo. She's had antibiotics. I'm about to check on her treatment sheet and see what her temperature is, since she was pretty high, 105, 104 yesterday. But I feel good that she at least has some appetite now. Do you want some appetite? So crabby yesterday. Oh, goodness. Here, eat your food. Hopefully we'll get her blood work back today. If not, we'll get it first thing tomorrow morning. Apparently Cleo ate a little bit this morning. Hi. Day 2 on fluids. Baby girl. Oh, somebody's purring. It's hard to take her seriously with that cone on, isn't it? Oh, I'm glad to hear that, babes.
So I was a little worried about Casey, the way she was walking out there. It's been 6 weeks since we did the surgery, and today is one of those bad days as a vet. We haven't seen her, obviously, since the surgery, and it's just a disaster. I'm kind of amazed that she was walking at all. This is supposed to be going in there. Honestly, I'm not 100% sure how that happened, but it's not going to heal. It looked good post-op, but who knows what happened. She was with a foster. I don't know if she was confined. I don't know. It may just be one of those things. Sometimes bad stuff just happens. Sometimes stuff just doesn't go right. So I hate to do it, but we're going to have to amputate this leg. This is a risk anytime we do these surgical fixes, but I really didn't want to. That's why we tried, but I don't think this is ever going to heal properly. She can walk right now. You saw every third or fourth step she'll put the weight down. You know, the risk is that this could become worse and worse and cause more pain. She's doing okay right now, but that doesn't mean it won't be a problem later on. Unfortunately, I think I'm going to have to take this whole leg off. So it's a bummer. She's going to be fine. She's not going to care. She's happy already. My old boss used to say this is a very humbling profession, and he is correct. I feel very humbled today. She's going to come back next week. We'll amputate this leg, and in 10 days she'll be ready to go to her new home. We'll show you that surgery too. Hopefully it goes better. Alright, Porky's been with us here in the hospital a couple weeks, resting and healing, hopefully. But he's actually doing really good. So, we went ahead and x-rayed him. Here's his leg. It's healing. It's all healed up. The bone is one solid piece now. There's the pin we put in. There's the wires. So, we are going to pull that pin out today. It's not necessarily causing any problems, but they can migrate, those pins, so there's no reason to keep it in there. It's not adding any stability or anything, so we'll take it out so it doesn't cause problems later. And then we're going to neuter him. I know people ask about that a lot, why we neuter all these dogs. In certain parts of the world, stray dogs aren't a huge problem, but here where I live, in Texas, South Texas, it's a huge problem. Just like big dogs wandering around our little town. They don't have owners. They're at risk for contracting diseases like rabies that they can give to people. Sometimes they're a menace. We've had dogs attack people in this town, so there's also some, for sure, health benefits to neutering these guys. So all that added together, it's not because I just sadistically enjoy castrating animals. It's my job to provide services, public health services that help people and also animals. So that's why we do it. And there's no guarantee that Porky's not going to end up on the streets again, and if he does, we don't want him making more stray dogs to maybe get rabies or attack people or get hit by cars or whatever. So it's a multifaceted decision, and it could have generational impacts, right? There's not going to be generations of Porky dogs, Porky puppies running around out there. So I know sometimes it seems a little unnecessary or barbaric. It's not. I know it's not. I stand by it. It's the right thing to do, especially for here. So we're going to neuter him too, and we'll show you that. Okay, so you can see this bump here. I can feel the pin. This is going to be a really small incision. A little bit of fluid there. That's another reason I always remove these, is they can be fairly irritating if they're here like this under the skin. Oh, goodness. Little bit of serum there. So there's the pin, and I'm going to use my chuck, my hand drill. It's really easy to pull out. There we go. So here are the two testicles. I'm going to do a pre-scrotal incision. This is what I do on essentially all my castrations. I do this several times a day pretty much. There's one testicle, two ligations here so it doesn't bleed. Cut the testicle off, and then I like to watch it, make sure there's no bleeding, which there's not, and the cord goes away. And I'll do that again. Alright, testicles are done, are gone, no bleeding. Now I'm going to sew him up, and that'll be it. There will be no risk of more stray dogs getting hit by cars or causing any other disasters, even if Porky gets out. And in addition to which, we're preventing testicular cancer because they don't have any testicles anymore, and we're drastically decreasing the risk of prostate cancer. So, benefits him, benefits the community, benefits everybody.
Okay, let's check on this little goob. Come here, let's show everybody your neck. Oh, it's so much smaller already. 1 week later, look at that. It's probably half the size. Clean it and laser it again tomorrow. Yay! It looks like someone tried to cut your head off. You ready to go in?
You want to go inside? You want to come inside? Come on. Are those your friends?
She's like, I'll play with anybody.
Okay, Hera is here, and we're going to do a couple things for her today. One, we're going to laser her wound and also clean it. And so, let's see. I just want you to take a look at it. It's looking really good. You may be able to see it's contracting down, which is exactly what we want to happen. And she is just so good. She's just always in a good mood. Right now, she's a little bit nervous, but always in a good mood for us. Really sweet dog to rescue. Now we're geared up to do the laser. Commence laser beam. Okay, she's bored with this. So we got Hera cleaned up, we got her laser done, and we'll continue just to do wound care and keep you updated throughout the weeks. I think she's not excited about this anymore. She's so good. Okay.
Well, I'm an idiot because I'm about to get all of these little fish because I'm so freaking sad for them because they're dying. Ugh. All right, ignore all the trash everywhere, but this is gonna be our setup for the fish. I have the light off because I'm about to put them in the tank so they can de-stress. My temp's rising because these guys like a much higher temp than my other freshwater tank. So we'll get some warmth in there for them and just let them decompress. Let's take a look at them. It's not looking good. I think there was one that was a lot worse than the other ones. Like their color is so bad. Fins look bad. Whoa, this one almost completely has already changed colors. Whoa. And then this guy, bad shape down there. So let me go ahead and get him in. I'm just gonna put him right in because it's definitely gonna be warmer than this room temp water right now. There you go, friend. Oh, bye-bye. All right, I wish I could turn on the light and show you them more. Oh gosh. That does not bode well. This friend probably isn't gonna make it, clearly. That sucks. We'll let him chill overnight. See how he goes. Poor baby. It's so sad. No fish vet, but that does not bode well. Still no bueno. It's not looking good for this kiddo. The last one standing. She's moved from the corner freaking out to at least going in this little hidey hole. However, she doesn't really do anything but stay in this hidey hole. But hopefully that means she's a little more with it if she knows where she's at. So fingers crossed, this might be a step in the right direction, but I really need her to start eating. Well, checking on Meeps and Han. It looks like Meeps gave Han a little bit of a eye infection that she was completely healed from. Buddy. Meeps, I hope you're proud of yourself. She's like, I am. I love him. But, so we're going to start him on some antiviral eye drops and some oral antivirals now. I think his eyes are probably just red because he was scratching at them. Bubby. He got the eye disease from Meeps, his girlfriend. So we have to do this every 5 minutes for 6 doses. So I'm trying to hold a camera at the same time. Oh, I missed. Let me open that eye. Boop. Good job. He's almost dead. Greta, this isn't your baby, okay? Greta? Winnie has settled in too much, guys. I need her to get adopted. This is when fostering is totally hard. Always worth it, though. Don't be so rough. These two bros. Stop, silly. Oh my God, you guys. I don't know why Fergus isn't adopted. He is so cute, and he's a puppy. Everybody wants puppies. What is happening? We're rechecking Berkeley. It's like she forgot that she used to live here. She's so tentative now. Bert, she's so nervous. Today is spay day for Berkeley. Look how big she is. Can you guys believe it? She's gonna get to be adopted after this, and that'll be her journey with me, and then she'll get to go live her forever life with her awesome adopter who has another cat who is not quite normal with spinal issues, so it seems like the perfect fit. How about my cakes? She's not happy.
We are here with Berkeley. We're going to sedate her for her spay. We got to be careful because we don't want to mess with her back that much because of her injury. So we're going to restrain her a little bit differently. Here we go. Oh, that's a good girl. Oh, I know that stuff. Berkeley, post-op. A couple hours post-surgery for our cute little Berkeley here. Doing great. High on pain meds, which is great. We just pulled the catheter there. I wish you could hear. She's purring. Yes. So all is well. Happy to have her spayed, and it's just always good to see them recover. Raya, we got Raya here. She just downed, maybe, possibly, her Brevecto, her Plan-Tig tablet, awesome. She's also receiving a 12-month cohort injection, which we'll give right now. So she's doing great. Hopefully we'll get her home soon. All is well.
Well, we had to move the sports car kittens back into ISO because they started showing respiratory signs again. And this is their third cage change of the day because they are bonkers. So they're looking better now. I think we're gonna go ahead and move them back and hope that we're at the end of this illness because they're crazy. Are you ready to go? Well, we just moved them. They can't come out yet because little Cleo is out, but they're cracking me up. So now they have a little fourplex, their little quad, and we'll let them out shortly, but they are so silly. Well, thank you guys so much for joining us. Wrapping up another week at Vet Ranch RoundUp. I am heading this weekend to take Raya to a potential adopter. I'm very hopeful for this home because she's definitely number one on my list besides Muffin, because Muffin was so shy of getting adopted. Ooh, everybody keep your fingers crossed and I'll let you know next week. But thank you guys so much for watching our videos, and thank you for anyone who donates to Abandoned Pet Project. You know, some of you guys say like, I'm sorry that I can't donate, but you know, I would if I could and things like that. But you don't realize how important it is just watching the videos, sharing the videos, subscribing, liking, all of those things that are completely free that still propagate our cause and let other people know about it. So that, don't say that you're not, you know, you feel like you're not helping or you wish you could help, because you are. We feel your support and love from here. But thank you guys so much. Thanks to Abandoned Pet Project and everyone who donates to them. Without them, we could not do any of this work. And we will see you next week. Bye. Say bye, Squeaks.